About 40% of people in jails and prisons have a mental health condition, more than double the general population. Many experts and advocates say what a lot of those folks need is treatment, not incarceration. Enter mental health courts. Instead of putting people behind bars, these specialized courts divert people who've been charged with crimes into community-based supervision and treatment. Proponents say mental health courts can be life-changing, but critics question their effectiveness and their entanglement in the criminal justice system.
It's complicated because we're trying to make a court a therapeutic place, and that's not how courts were designed.
Today, a deep dive into the evidence and individuals behind this approach to keeping people with mental illness out from behind bars. From the studio at the Leonard Davis Institute at the University of Pennsylvania, I'm Dan Gorenstein. This is Tradeoffs. It all started at a farmer's market.
I happened to be talking to people at the Kankakee Farmers Market, and someone there mentioned to me that Kankakee had just launched a mental health court, which was the newest in Illinois.
Grace Hauck is an investigative reporter for the Illinois Answers Project, a nonprofit newsroom that covers the land of Lincoln. She just spent a year and a half reporting on people with serious mental illness who were languishing in Illinois jails, but she'd never heard of a mental health court.
When I started trying to learn more about what are these, often the kind of news stories I would see were County X launches mental health court, or 5 people graduate from Grundy County Mental Health Court, which is great, but there was never a deeper look at, are they actually working? How much does this all cost? So those were big questions I had going into this.
Grace quickly learned that mental health courts have been around for nearly 30 years now, totaling more than 600 across 40 states. They were designed to divert people with mental illness from jail to treatment. To answer the rest of Grace's questions, she teamed up with Josh McGee, the Chicago bureau chief for MindSight News, a nonprofit news organization that covers mental health. Together, the two did a deep dive on Illinois mental health courts, culminating in a 4,000-word story published earlier this spring. Grace, at a high level, how do the courts work?
Sure. So say in Illinois, you are someone who has a severe mental illness, schizophrenia, bipolar disorder, and you are charged with a crime. It's possible you may get referred to the mental health court. And this would look like a year, maybe 2, of essentially enhanced probation. You're showing up before a judge with other people in the mental health court program to do a quick status check. You're showing up for random drug testing. You're having regular meetings with a treatment provider, with a probation officer. For some folks, this is a life-changing experience where they may receive a diagnosis for the first time, they may receive treatment for the first time, and they now have the chance to have this charge dismissed and expunged, and it becomes much easier to get a job, to get housing, and to move forward.
You got to see mental health court in action at the Kankakee County Courthouse. That's about 60 miles outside Chicago. What stood out to you from that time there in Kankakee?
I was surprised by the dynamic between the participant and the judge. It really becomes this ongoing relationship. There might be gifts or treats, prizes for people who are doing well. I saw someone who was keeping up with all her appointments, going to drug testing. She got to spin a wheel for a prize, and the judge gave her a hug and some Reese's Pieces candy.
This is like some game show, a game show at the court.
Yes. And I kept kind of sitting there wondering, is the way the judge is speaking to people, is it really compassionate and humanizing, or is this patronizing? How are the participants feeling about this dynamic, this power dynamic? It's also very high stakes because sitting there, I saw someone who wasn't keeping up with his testing sentenced to 24 hours in jail, and officers immediately came forward, handcuffed him, led him out of the room, and there was a hush. And the other participants clearly were shocked by that moment and frightened. I also saw someone who was cut from the program. It was very emotional. His name was Sean. We talked later from prison where he's not getting any treatment for his mental illness, but his mother testified that day asking the judge for another chance, and ultimately the judge said no. And so to me, it all felt very high stakes.
So, I mean, listening to these descriptions, Grace, it sounds like at least what you witnessed in Kankakee is a kind of interesting hybrid where on the one hand, it can look like a game show or potentially therapeutic or supportive kind, but also it can look a lot like court. Is that right?
Definitely. And I think what you're describing is also the idea that like the court system can play a role in mental health. And I think this is also why there's a range of views on mental health courts. You have people who are really supportive and you have people who are very critical and think that this model is not helpful.
When you did your reporting, you were able to interview a handful of folks who had graduated from these courts. Can you walk us through one of the like model stories or success stories?
Sure. So someone who comes to mind for me is Shayla Woodworth, someone from the Bloomington Normal area in Illinois who had really struggled with her mental health and cycled through the criminal justice system for many years, spent time in jail in 3 states.
My addiction was very prevalent throughout my life. I literally had in my brain I was either going to be dead or in prison for the rest of my life at 30, because I was going so hard that I didn't want to stop.
She and her husband had stolen a car from outside of an emergency room in Champaign, Illinois, and she was facing prison time. And she was given the option for mental health court.
I knew that if I went to prison, I was going to use, and then I was going to get out, and I was going to keep repeating the same thing.
And so she went through the program. She built her life around the program. She became very involved and graduated. She's now become an advocate for criminal justice reform in Illinois and really says that this program for her was life-changing.
But I thought, I'm going to make it, I'm going to do what I need to do. And I was very determined to do this. It's just, it's really cool.
In your article, Grace, you lay out that there have been some 6,000 people who've gone through the program over the last 2 decades. And you've talked to a bunch of people like Shayla and tons of other folks in the system, judges, advocates, prosecutors. And you summed up Illinois mental health courts by saying, quote, "It's a promising model with limited funds supporting small oases in an otherwise barren desert." And that sentence really struck me. I'd like to dig into each of those 3 elements, starting with the promising model part. What's the best evidence out there that this is, in fact, a promising model?
Yeah, I think that when it works, it really works. And the individual testimonies of people who have graduated are really some of the best evidence.
Like Shayla.
Like Shayla, there are so many folks. Of course, being an investigative reporter, I also wanted to see the data. And so my coworker Josh and I reached out to all 31 mental health courts in the state to try to get whatever information we could. We were able to find a number of studies, not a ton, across the state, showing that indeed these courts do reduce recidivism. We found that looking at the data, about half of people graduate. I think there's a big question of, if half of people are graduating and getting through, is that enough? Is half enough? And a lot of what I would hear people say is, that is half of people who were never given that opportunity before, who are now far less likely to cycle back and recidivate through the system, and it's all saving taxpayers money. And so for folks who are supportive of this, it's kind of a no-brainer, because even if not everyone is getting through, it's giving thousands of people access to treatment and resources that they didn't have before.
And just to underline your saving money point, you write in your article that the state estimates mental health courts and other interventions to divert folks from incarceration have saved taxpayers about $500 million over the past 15 years. But still, you've interviewed advocates and providers who don't believe mental health courts are a, quote, promising solution. What's the essence of their critiques?
The top line would be treatment and helping people with severe mental illness should be outside of the criminal justice system. Why are courts and law enforcement, why do they have anything to do with this? And that mental health courts are kind of this distraction. And there are concerns that people may feel coerced into this. If it is a choice between mental health court and the criminal process that will likely result in 4 to 5 years in prison, is that really a choice? There are concerns that the existence of a mental health court may encourage officers to arrest someone in order to connect them with treatment. So there's really a range of concerns, but what it comes down to is that the law enforcement and the courts have no place in this discussion, and that this is something that really needs to be a much more ground level, helping people get access to treatment and resources that they need before they even interact with the system at all.
When we come back, Grace talks money and access to mental health courts, and a national expert puts Illinois' experience into context. Welcome back. We're talking with Grace Hauck, a reporter with the Illinois Answers Project, who worked with Josh McGee with Mindsight News on an investigation into mental health courts in Illinois. Grace and Josh summed up their findings on these courts as, quote, a promising model with limited funds supporting small oases in an otherwise barren desert. So, Grace, we've talked about the promising model part of that sentence. Let's dive into limited funds. Where does the money come from to support mental health courts, at least in Illinois?
So courts are often scraping together a combination of federal, state, and local funds. Many receive support from one state program. It's called Adult Redeploy Illinois. It's a $13 million a year program. Others are taking money out of their county budgets to make this happen, or getting specialty individual grants from various universities, local groups. And some of these funds are federal funds that come through federal block grant funding. And so it's really a combination.
And something that you pointed out, Grace, in your reporting is that President Trump has said he supports the courts, but the so-called One Big Beautiful Bill is going to result in lots of steep cuts to state Medicaid budgets. Based on the reporting you've done, what kind of impact might the so-called One Big Beautiful Bill, or H.R. 1, have on the courts?
I've put that question to many of the mental health courts in Illinois, and what they tell me is they don't know yet. They're anxious and apprehensive about what's coming down the pipe. Much of the actual treatment, especially the inpatient treatment that people might receive, that is often funded by Medicaid. And so when there is so much uncertainty, people who operate mental health courts don't know what to expect. I think they're all preparing for the worst.
You say preparing for the worst being that these courts shut down and go away.
I think the worst being that Medicaid is no longer an option. And so what mental health courts are able to offer people becomes far more limited, or that it is possible they could shut down. I don't think courts know yet.
Right. And if the opportunities for services are limited, that's going to likely make graduating harder, success harder.
Definitely. And graduates already are dealing with a range of issues that I heard from many folks. Transportation's already hard to navigate. Housing's already hard to navigate. Childcare, working and having a job that you can build around mental health court, that's already hard. So if you're talking about losing access to Medicaid, it just becomes incrementally harder.
Okay, let's move on to the last part of your takeaway here, that at least in Illinois, these courts are, quote, small oases in a barren desert. Who, Grace, is getting left out?
So we found that there's nearly 2 million people who live in Illinois who live in counties that don't have a mental health court. And those are predominantly counties that are more rural, that have lower median income levels. If someone in Cook County has bipolar disorder and is charged with retail theft, this might be an option for you. But if the same person lives in Champaign County, that's not an option for you right now. It can be done in some of these smaller counties. For example, in one judicial circuit, there are 3 counties that each have fewer than 35,000 people. But each of those counties has been operating a mental health court. So I think there's kind of the question of, if they're dealing with limited resources already, but they're able to make it work, why couldn't others?
Final question. Again, big deep dive into these courts. You interviewed, I'm guessing, dozens and dozens of people. What do you think, Grace, is going to stick with you from this reporting?
I think always the people, of course, and their individual stories. I think those moments just sitting on that bench in the courtroom and the images of that will stick with me.
Why? What about those images?
Because I think there's a gray zone there. There are moments where I can feel the conviction of the participants who feel that this is helping them. And then there are moments where I wonder, why the judge speaks to someone like that, and whether immediately sanctioning someone to 24 hours in jail is going to traumatize them, and whether that is the most productive way to help someone get through the program. And so I think for me, sitting in that room is that moment of understanding that gray zone and the difficulties of balancing those.
The power and the peril.
Yes, the promise and the
problems.
Yeah.
Grace, thank you so much for taking the time to talk to us on Tradeoffs.
Thank you so much for having me.
Grace and her colleague Josh McGee went deep on mental health courts in Illinois, but that's just one of 40 states around the country that use this tool. So we called up Debra Pinals. She's a psychiatrist and a professor at the University of Michigan Medical and Law Schools. She's been working in and around mental health courts for nearly 2 decades. Debra, you've been involved in establishing mental health courts yourself in Massachusetts, and you've studied them as a researcher. I know you read the article about Illinois, and the reporter there, Grace, has described a system that offers some people real possibility, but even after 20 years, there's still tons of issues. Does that square with what you're seeing nationally?
I would say yes. Mental health courts, even as I was establishing them, I was very conscious of whether over years and years we would answer all the questions that were coming up. Certainly, there are many, 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 many individual cases where the court has helped people. Whether on a systemic level we've sorted out all the issues or answered all the questions, or whether we've helped everyone is less clear.
What are the basic ingredients necessary for a highly functional court? I'm guessing one of them is dedicated funding.
Dedicated funding and dedicated staffing, clear ideas of who's appropriate for the court, really trying to use that more therapeutic approach rather than a punitive approach when that's appropriate. It's complicated because we're trying to make a court a therapeutic place, and that's not how courts were designed. At the end of the day, I hope that we can move people more into treatment systems than having courts run treatment. But right now it is one tool that can be available for people who have funneled through the criminal system and have an alternative to incarceration that might be more appropriate for their mental health needs.
There's several national mental health organizations, as you know, that have serious reservations about the way the courts operate. In particular, there's the concern that these programs are coercive. You have thoughts on this kind of pushback?
I think it's appropriate pushback. I think we need both sides of the dialogue. They are coercive. I don't think it is wrong for the advocacy community to push to make sure that we are always paying attention to the rights of people with mental illness.
Skeptics of mental health courts say we're seeing these courts as a tool expand faster than the research supports them. What evidence do we need in your mind to better answer the question, are mental health courts working? Are they living up to the promise?
There was a great study that was done early on looking at mental health courts across multiple jurisdictions, and it showed that there was a reduction in jail days and arrests for participants. I think it would be nice to replicate some of those studies. Another measurement is, do people stay adherent to treatment post mental health court? Have we really turned this person's life trajectory around by giving them this opportunity? There's not as many studies looking at that. And I think we need more research. These are hard to research because, again, one mental health court can be one mental health court, and who's included in admissions and who's excluded can look very different.
Debra, I know a lot of your work now is more prevention-based, right? You're focused on trying to provide services to people in crisis before they end up in a courtroom. Things like 988, the National Mental Health Crisis Line, and facilities where people in crisis can go instead of hospitals or jail cells. Does that mean you feel like that's where more of our resources and time should be focused on prevention as opposed to something like mental health courts?
It's interesting. I do an exercise in my law school class asking them if they had a big bucket of money and they could spend it on any place along the criminal justice continuum, from arrest to specialty courts to reentry, how would they divide the money? Some people say, well, I'm going to put all my money in prevention. And then I say, okay, well, what about for those people it doesn't work? And they did commit some kind of offense. Don't they need support? And what if we have nothing to give them? So it's an impossible question. I think we have to pay attention to all of these places.
And that's the lesson of that class.
It's the lesson of the class. And be good lawyers and learn to advocate for people and public safety and understand that it's all very complicated how it plays together.
You talk about money there, and that sort of tees up our last question. How big of an impact do you think these impending Medicaid cuts due to H.R. 1 or the big beautiful bill are going to have on mental health courts and their ability to be this tool, this useful tool?
So something that's really important to understand is that if you go before a judge once a week or once a month, there's a life between court sessions. And what are the services the person is getting between court sessions? That's often not studied in mental health courts. Many of these people are on Medicaid. And one of the concerns is when people slip through the treatment cracks, they could end up more likely on the streets, uncared for, and potentially at risk for being arrested.
And so there's a chance that these courts are going to be busier.
Well, the worry would be if the courts are busier and the services are less, then you're asking the courts to basically be the mental health system, and that's not a good answer. It has to be a partnership. The judges need the mental health system to support people in between court sessions.
Because why?
Because that's where treatment takes place. They call them treatment courts, but courts are not treatment providers. They're not prescribers. They're not housing providers. They're not case managers. That's not what courts do.
Debra, thanks for taking the time to talk to us on Tradeoffs.
Thank you.
I'm Dan Gorenstein. This is Tradeoffs.
If you enjoyed today's episode of Tradeoffs, don't keep it to yourself. Tell someone else about it. Friend, colleague, family member. Better still, leave a rating or a review wherever you subscribe to us. The NPR app, Apple Podcasts, Spotify, wherever. This episode was produced by Christine Herman. The Tradeoffs team is producers Melanie Evans and Julie Wernow, senior producer Leslie Walker, managing editor Ryan Levy, managing director of partnerships and growth Eleanor Coetzee, marketing director Catherine Dougal, sound designer Andrew Perella, chief operations officer Colleen Scheck, with help from Kate Seepy, Cedric Wilson, and Haley Lerner. The executive editor is Dan Gorenstein. The Tradeoffs theme song was composed by Ty Sitterman, with additional music this episode from Blue Dot Sessions and Epidemic Sound. Tradeoffs reporting for this episode was supported in part by the Sozoze Foundation. Special thanks this week to Josh McGee and Megan Schuler. Thanks also to all our listeners who helped to support our work, including John Prendergast, Christian Lalonde, Rebecca Warnken, Lauren Yehudi, Michael Luggan, and Peter and Francis Buttenheim. Our media partner is Side Effects Public Media based at WFYI. Tradeoffs is supported by the Robert Wood Johnson Foundation, Arnold Ventures, the Sozoze Foundation, the Foundation for Opioid Response Efforts, the National Institute for Healthcare Management, the California Healthcare Foundation, and the Leonard Davis Institute at the University of Pennsylvania. Our financial supporters are not involved in any decisions about our journalism. The views expressed in this episode are those of the individuals and not those of Tradeoffs staff, advisors, or funders.